Welcome to the People of Color Living with Diabetes Virtual Summit. I am so excited to have you on for this year as a featured speaker. Hi, Dr. Wood. Tell everybody hello.
Hi, thank you for having me.
Well, we're honored that you decided to participate as a speaker for this year. Can you tell everybody a little bit about yourself?
I'm Dr. Kelly. I'm a board certified endocrinologist. I'm also internal medicine certified as well. And I practice here in Atlanta, Georgia.
Wow, thank you. So you mentioned that you're an endocrinologist. So tell everybody, for those of the viewers that don't know, what exactly is an endocrinologist?
So I'm a doctor that basically deals with hormonal issues. And the reason why I treat diabetes is because insulin is a hormone. Other conditions that I treat would be like thyroid disease, osteoporosis. So you can think of anything that's hormonally related, you can see your endocrinologist for.
Okay. So as a person living with diabetes, why should I either go see an endocrinologist or be referred to an endocrinologist?
I believe that all type 1 patients should really be seen by a specialist. In addition to being internal medicine trained, I also did additional years just definitely specializing in diabetes. So it's the bread and butter of my practice, is what I do each and every day. So if you have type 1 diabetes, you should be seen by a specialist. If you have type 2 diabetes and your A1C is, I would say, above 9 or 10, that's a good reason for you to see a doctor, especially if you and your primary care doctor have been working for many months or years and the numbers have not come down. It might be time for you to see someone else to get a special set of eyes looking at your case.
So it seems like to me, an endocrinologist is really someone that's going to give you that intensive care management when it comes to managing and treating your diabetes, which is great. Like you said, there's some patients that need that and some patients that necessarily don't. So you talked about type 1 and type 2. I don't think in other segments we really hit on that very much. So tell the viewers, what are the most common types of diabetes, and then a little bit about the different types of diabetes.
First, we should start, what is diabetes? And glucose or sugar is the main source of energy for our cells. And the hormone insulin is responsible for taking glucose from the bloodstream into the cells where it's used as energy. So you can kind of think of insulin as the key that unlocks the door for glucose to go into the cells. So in type 1 diabetes, the pancreas does not make insulin. It doesn't make much, if at all, any insulin. However, in type 2 diabetes, the pancreas actually initially makes a lot of insulin, but the insulin doesn't work. The key doesn't fit the lock anymore. So what that happens is the sugar builds up into the bloodstream. That's what causes diabetes. So type 1 diabetes is an autoimmune illness. It accounts for about 5 to 10% of all cases of diabetes. And right now in the United States, there are about 32 million people who have diabetes. About 88 million have prediabetes. A lot of people don't even know they have a problem with their sugar. But in type 1 diabetes, like I said earlier, it's an autoimmune illness where your immune system makes antibodies that attack your pancreas. So your immune system protects you from viruses, from bacteria, from infection, from things that are foreign to your body. But in autoimmune illnesses, the immune system turns on your own body. Type 1 diabetes typically happens in children, teenagers, adolescents. It's not, right now, there's no cure for type 1 diabetes. Type 2 diabetes, the hallmark of type 2 diabetes is insulin resistance, meaning you have lots of insulin around, but your body is resistant to it. In terms of risk factors for type 2 diabetes, having a family history of it, being overweight or obese, being sedentary as well. Those are the main differences between type 1 and type 2. A lot of patients with type 2 diabetes start off on oral medications, but it's a progressive illness. So what you see commonly is you start off with one medication, then you add a second and a third, and eventually a lot of type 2 patients might end up on insulin as well.
I'm glad that you said that it's a progressive condition, because what I've found in my years of providing diabetes education is patients with type 2 will come in and they get so frustrated when they have to transition to insulin as if they failed. And, I always talk to them and say, those beta cells, they continue to get weaker. They die out over time. You can be the model patient. You can eat right. You can exercise. You can do everything that you want to do. But it's because, like you described, that autoimmune dysfunction that occurs that actually helps contribute to that. And it's no one's fault. So you talked about insulin resistance as it relates to type 2 diabetes. Can you go into some ways that a person with type 2 diabetes can actually help improve that insulin resistance or decrease the resistance that of the insulin so that it works properly to unlock that key to the cell?
So two great ways to reduce insulin resistance. One is weight loss. And the second thing is exercise. Whenever you exercise, your muscle cells, it increases the ability for your muscle cells to take up sugar. So what I recommend to my patients, especially, we eat our biggest meal at dinner and then we go sit in front of a television. So I recommend, go for a walk in the evening. So exercise and weight loss. Also, there's a medicine that's called metformin. It's one of the most commonly prescribed medicines for type 2 diabetes, even pre-diabetes. And metformin also reduces insulin resistance. So those are my go-to for my patients with type 2 diabetes.
Great. And you said that exercise and weight loss, those are also the two most common things you can do if you have pre-diabetes, something that I live with. That's very important. And I know people hear us harp on that all the time, diet and exercise, diet and exercise. But if you look at it as a lifestyle and not as diet and exercise, something that I always tell my patients, Rome wasn't built in a day. It's baby steps. It's that positive, healthy lifestyle change over time. So thank you for that. One of the things that we've talked about a lot during this summit, is LADA. Can you explain what LADA is?
LADA stands for latent autoimmune diabetes in adults, and you can kind of think of it as type 1.5. So remember I said before, type 1 diabetes is an autoimmune issue where your immune system attacks your pancreas, and type 2 diabetes is usually because of insulin resistance. So in LADA, usually the diabetes occurs in patients who are over the age of 30, and it is also an autoimmune destruction of the pancreas. However, the reason why patients with LADA don't present until later in their life is because they don't have as high titers as, say, a type 1 child has. And there are more than one antibodies to the pancreas. And patients with LADA they don't have as many types of antibodies as, say, a type 1 child would. Most of the time, patients with LADA are also lean, meaning they're not overweight or obese. But I have seen some overweight type 1 as well as overweight overweight LADA patients as well. In terms of treatment, sometimes LADA can be misdiagnosed as type 2. So initially they might be also placed on oral medications, but they can fail quickly. Most of the time, by the time they get to me, a LADA patient, I treat them like a type 1 patient.
And so if I've just newly been diagnosed with diabetes, how can I be sure that the doctor is not misdiagnosing me? Because a couple of the speakers have said this exact same thing. I know this has happened before. I've seen it myself. So how can a person be sure that they have the right diagnosis so they can get the right treatment?
The clues that I use when someone comes in front of me, it just doesn't fit the picture. So I see someone who has a BMI of, 22, someone who's like normal weight, who does not have a family history of type 2 diabetes. Those are two red flags that you might have LADA. Also, type 1 patients, if they don't take their insulin, or maybe they have an infection or something else going on, like something traumatic, they can go into what we call diabetic ketoacidosis, where there's buildup of acid or ketones in their blood, and they end up having like nausea, vomiting. Sometimes the acid-base balance is thrown off and they end up, in the ICU. So type 2 patients typically don't get DKA. If your blood sugars are really, really high, some type 2 patients can get it, but typically they don't. So if I see someone who is lean, who does not have a family history of diabetes, who might have had DKA in the past, those are 3 clues that I need to check for those antibodies. And I do them all the time. And it's important because, I don't want your viewers to think that type 2 diabetes is a death sentence. Like type 2 diabetes can actually be reversed.
Mhm.
It can be reversed if you are aggressive in controlling your blood sugars. The sooner the better. So closer to your diagnosis. If you make the lifestyle changes within 2 to 5 years of your diagnosis, there's a high chance that you could reverse your diabetes. If you wait too long to make those changes, that chance is lower. So it makes a difference to know if someone has type 2 or LADA. If they have type 2, I tell them, you know what, there's a high chance if you really make the changes, you can get off of this insulin, you can get off of these medications. However, if you have LADA, it's unlikely you can get off of medications.
I'm so glad that you mentioned that people can actually reverse diabetes. Type 2 now, not type 1. We're talking about type 2 diabetes. But it's important that people understand that that's not a cure, that there's a difference between reversal and a cure for something. And so one of the things that I always try to make sure people understand is if you do what you're supposed to do, then you can stay, at that A1C that's lower than 6.5. However, what I tend to see happen is people will get down to 5.9, 6.0, 6% and say, oh, I'm cured. I don't have diabetes anymore. But they slowly will transition back into those old lifestyle habits, and then their numbers continue to rise again. So I just want to make sure that the viewers understand it can be reversed, but you still have to put in the work to do that.
I did not say cure because there's always the risk of relapse with diabetes.
I like that. Now let's transition a little bit and talk about COVID-19, specifically as it relates to diabetes, because we've been seeing all on social media, all in the news, and hearing about those underlying conditions like heart disease and diabetes that put people at a greater risk. So can you speak to that and tell us exactly how COVID-19 can affect you if you are a person living with diabetes?
Diabetes does not increase your risk of getting coronavirus. However, if you do get coronavirus, having diabetes increases your risk of having a serious complication and even death. And a lot of the early data definitely showed that this was one of those underlying, pre-existing conditions. So 2 reasons. One, when you have diabetes, your immune response is weakened. So your body cannot fight off infection as well as someone who doesn't have diabetes. And secondly, viruses and bacteria, they thrive in sugar. They like sugar, so they're going to replicate faster. And also, a lot of the complications from COVID-19 have been linked to an exaggerated, cytokine or immune response to the virus with lots of inflammation, and diabetes is also one of those inflammatory processes. So a lot of things play a role into why someone who has diabetes has a higher risk. Also, patients who have diabetes tend to be overweight or obese, and obesity is its own independent risk factor. Also, these patients have hypertension, and then they might also have heart disease. So you have one person who has 3 or 4 of the risk factors for, dying from coronavirus. So I tell my patients all the time, if you ever needed a reason to take care of your blood sugars, like now is the reason for you to do it. And a lot of my patients have been like emailing me or calling me asking for letters for work because they know that they're high risk and they're concerned about their health.
Wow. I've never quite heard an explanation like that. I've heard, of course, it's the sugar and bacteria thrive in that, and it's an autoimmune process, but the way that you describe it and you just compile, one comorbidity on top of another, that's really complex. And it goes to show exactly why this population is more susceptible than other populations. Wow.
The good news is that if you control your blood sugars, you can lower your risk of having a serious complication from COVID-19 back to someone who doesn't even have diabetes. So a lot of my patients, some of my patients, not a lot, some of them have really taken this time during the pandemic to get their blood sugars under control.
Wow. So word of advice for those that are watching, if you have not started taking this thing seriously yet, now is definitely the time. So I want to ask you questions now as a woman of color, and this is a People of Color Living with Diabetes virtual summit. Do you think it plays a role when you're providing patient care to your patients that you can identify with them because of your color and your background?
Most definitely. I'll tell you a story. So I'm a very kind, loving person, but I'm that doctor that will tell you straight up what you're doing to your body. I think a lot of patients, you know, they go to their primary care doctors every 3 months. Their A1C comes back between 8 and 10, and nothing happens. You know, there's no progression. Like, they keep them on the same medications. They're afraid to raise the topic of insulin. So these patients end up having all of these complications. You know, I've seen every complication walk through my door. I've seen stroke, I've seen heart attack, I've seen amputation. I've literally seen every complication in front of me. So when I tell my patients, listen, if you keep this up, you're going to have a complication. So one day I had this patient, this African-American gentleman, probably in his, I would say, late 40s, and he came with his wife, and I had seen him a month earlier. I'd given him a plan, and he came back and nothing had changed. And I'm like, what are you doing, sir? Like, do you want to have a stroke? You know? And he broke down crying, and he was like, none of my doctors have ever taken the time to really break it down like this for me. And then his wife said, you look and sound just like his sister. And I guess that, you know, seeing someone that looked like his sister, like, really made the point even clearer for him. And that's when I realized that a lot of my patients, they feel more connected to me. They feel that I understand them a little bit more. Some conversations that we have, they might not have felt as comfortable if I wasn't who I was. And, you know, I don't have diabetes, but I've also been a patient, you know, navigating the medical system. And it does make a difference when you feel like your doctor understands where you're coming from.
Wow. And we hear that, you know, of course, as a healthcare consumer myself, I certainly understand. And, you know, I've taken on that motherly role a few times myself. So I can certainly relate as well. Thank you for answering that. It's one, you know, it's not that you're scolding patients, right? We're not scolding them, but sometimes you have to take that tough love approach. And I think it's a lot more well received, which is probably unfair. You know, it's a little bit biased, but I think that approach that you took is probably going to be a lot more well received because you're a person of color, if they are too, than it would be if it was coming from a white male doctor saying the exact certain thing. So this has been a wealth of information. You've shared so much, so many jewels and nuggets with the viewers. First of all, tell us about Dr. Kelly's ebook. So I saw this on your website. Looks like a hypoglycemia report. First of all, what's hypoglycemia for people that don't know? And tell us what's in your ebook.
Basically, it's for you if you have diabetes or prediabetes and you want the tools to lower your blood sugars to reverse your diabetes. So I have information about carb counting in there, about exercise, about even different supplements and stuff that you can get that might help with your blood sugar control. I have some sample diets in there as well, and you can get the ebook from drkellysebook.com.
drkellysebook.com, and we'll make sure to put that in the comment below the video. Tell the viewers where they can find you. Are you on social media? Where can they follow you?
So you can follow me on all social media handles at Dr. Kelly Wood MD, and that's DrKellylWoodMD. I also do diabetes coaching as well. So if you're interested in that, you can also reach out to me. My email is drkelly@drkellywoodmd.com.
Wow. Thank you so much. And it is Dr. Kelly Wood, not Woods. I know I got that a little bit in the beginning. Dr. Kelly Wood. Dr. Wood, this has been wonderful. Thank you so much for your information and your insight, and for being a part of the very first annual People of Color Living with Diabetes Virtual Summit. Look forward to talking to you again soon.
For having me.